All right, I'm Adam Gomez with Moxie Mentoring. I'm super excited to have some guests with me today. I've got three other gentlemen who a lot of you probably know already. If you don't, and this is the first time, I'm happy to introduce you to them. Both Dave and John are with Kamana Health. Dave, John, welcome. And I've
Hi
also got,
there. Thanks, Adam. Thanks for having us.
yeah, absolutely. Thank you. And Joe is actually here. Joe's with Great Recruiters. So we've got three organizations represented: Moxie Mentoring, Kamana Health, and then we've got Great Recruiters also. I want to give you each just a little opportunity to talk about yourself, what you do, and also what your company does, for those that aren't familiar with. We'll start off with Joe. If you want to take just a second, Joe.
Yeah, thanks, Adam. So I got to know Adam and Moxie when I was taking an ATS, healthcare specific ATS to market about 5 years ago. And that kind of got me into the staffing and recruiting bug, especially with the travel nurse staffing. At Great Recruiters, I've been with them just a short period of time. The company itself is about 2 years old. We really, I think we have a really good team that we put together now as far as sales and customer support. And we were born really to help you guys manage the experience. So we know that a lot of you are promoting really good experience, really good brand. You really care about the nurses. And so what we do is we automate the ask and then we capture and then help you guys promote that information. And I'm sure I'll have a opportunity to get into some specifics later on.
Awesome. Thanks, Joe. And thanks again for being here. John, I'll let you introduce yourself and kind of what you do and what Kamana does.
Sure, yeah. So I'm John Modica, one of the co-founders of Kamana. My background is actually in travel nursing, so I was on the clinician side of this equation. And, just looking at the space, credentialing, it's like such a pain point that doesn't have to be, right? So we're looking at everything from the moment that an awesome recruiter reaches out to a travel nurse, the way that they facilitate that transfer of data. So making it easy for travel nurses, either with a Kamana profile, to self-organize and track and manage that stuff and share it with recruiters. And then for staffing agencies, just making that whole time, speed to submittal, right? So compressing the time from meeting a great traveler to getting their stuff over to a client and then going through that onboarding process so that, we can focus on just the relationship part of this. So it's kind of our bread and butter. Dave, I'll maybe let you introduce yourself.
Yeah, sure. You covered the company well, but I'm another one of Kamana's co-founders and known John for a long time and worked in healthcare for a long time, and really, really excited about the past year and a half, 2 years we've spent in this travel nursing and travel healthcare space. There's a lot to tackle, and we're just taking it one step at a time and trying to make life a little bit easier for everyone on both sides.
Awesome. Again, I'm excited to have you guys. Both companies do a fantastic job of really kind of focusing on that experience piece, which is so important. Of course, at Moxie, we're focused on best practices for recruitment teams, training for recruiters. We're here as a group to talk about COVID-19, to talk about how it's impacted travel healthcare, to talk about how agencies can come out of this. I'm excited to say that today I actually spoke with several different folks from different companies, and jobs are starting to kind of slowly come back. But I'd love to get your take kind of on what you've seen in conversations maybe that you've had with different staffing firms. John, you want to give it a stab, kind of talk about what this has meant to staffing firms, what you've seen as agencies have kind of had to evolve through this?
Yeah, definitely. And I know that your conversations with staffing firms are going to be a lot more intimate on kind of their back end workflows and stuff like that. But, I guess I'll first start with kind of the behavior of the traveler side, right? So the average lifespan of a traveler being, 3 to 5 years, typically, most travelers haven't seen volatility in the market like this. So went from a ton of jobs, right, peaking at COVID with all these crisis needs and just jobs everywhere, to absolutely nothing. So obviously the behavior of the travelers have changed. You've seen a lot of them move back into perm jobs, not really having the stomach for being able to go this long without having a job or not knowing if your contract's going to get canceled, stuff like that. And then you've seen a lot of travelers that have kind of evolved and adapted with it, and they're willing to take a little bit lower pay package, or they're willing to go to that city that they weren't necessarily considering, or even, hop over to another specialty that they're qualified to work, but usually isn't their top choice. So yeah, on the traveler side, seeing kind of that on both sides. And then for staffing agencies, I mean, it just wildly varies. It depends on how well equipped they were for remote work, how much they got disrupted by having to all move home. Seeing a lot of recruiters having to kind of buckle down and take care of their core desk of travelers versus going out and trying to find more as they're dealing with contract cancellations. So yeah, all kinds of stuff. It's been all over the place.
Yeah, I mean, you really hit on a lot of the bigger issues and things that I've seen and observed, I guess, and heard during conversations that I've had. We had that real big peak. Those, like you said, the crisis positions were out there. I think, we saw jobs just kind of disappear. I heard stories of 70 to 80% of the job board had kind of just in a matter of days disappeared. So you've got, like you said, recruiters working with fewer jobs, kind of focusing in on a smaller group of travelers and their core travelers. So, Joe, what about you? What have you kind of learned through this in conversations you've had with different healthcare firms?
Yeah. So, I think we've talked about this all kind of individually, but the thing that we decided to do early on was we wanted to be a resource, right? We wanted to support the agencies. And I know that you guys, obviously that's what you do, right? So in our case, we were still closing deals during COVID, which was good. It wasn't necessarily the deals I always expected. So, in this industry, I spent a lot of time with kind of those middle market, upper middle market firms, 50 million, 100 million, $200 million companies. And they kind of were the leaders when it came to, hey, here's some new technology, or hey, here's some something that I think can be useful to my team. Let's go ahead and do it. Right? They're very transactional when it comes to that, and a lot of those companies were kind of pushing the brakes a little bit, and some of this kind of strategic thinking versus the operational thinking I saw coming from a lot of smaller firms. Right? I think they just didn't have the same restrictions and kind of concerns. So what we were trying to do is really just support. And, great recruiters overall, for those of you that are going to watch this and don't know what it is yet, we want to promote the recruiters that are doing the supporting to the nurses. And so the ones that made the dive or the jump to come on with us during a global economic shutdown and pandemic, they were doing what we were trying to do, right? Like a lot of people, I still haven't even closed yet, but I knew people in the industry, people that, run VMSs or, larger companies are having trouble filling positions, right? When the needs were still there at the beginning of COVID, I just said, hey, I'm a resource. I know a lot of people in this industry. If you're trying to get in and submit, nurses or be a sub vendor to somebody, call me. I'll make the introduction, kind of vouch for you, and we'll take it from there. And I think that was certainly successful, but it was really just trying to support the industry. And I think those people that did sign on with us were trying to do the same thing with their nurses. And so a big piece of great recruiters is we drive referrals on top of just the reviews. And so 18% of our reviews come with a referral in healthcare. And so these recruiters didn't know what to do, right? They're used to making a phone call, and if they make enough of them, they'll get enough submittals to get enough interviews to get enough placements. And so it gave them something else to do, which was, hey, we're going to be graded on the experience that we create for these people. People are still picking up the phone. We might not have a place to put them, but let's really take the time to support them, understand what's going to happen, because, we can't leave everything shut down forever.
Yeah, that's great. I mean, there's a shift, obviously, from quantity to quality, which is what we saw in 2008, 2009, 2010, not just at the recruiter level, but at the agency level as well. So if for those of you, and I'm not sure if you guys were around during that, but, the number of companies that kind of were no longer companies after 2010 was pretty large, right? And so the same thing happened with some of the vendors that were out there at that time. Some of them just went away. Some of them weren't prepared for what happened, which is something that we saw with the staffing firms, something that you guys have alluded to, but some firms were in a better position than other firms for something like a COVID-19. I'm going to give you guys a chance to kind of talk through that, because I know we've had conversations, and I'd love to kind of get your take on why that was. Why were certain agencies prepared? Why were others not prepared or less prepared? And how you see what you bring to the table making a difference in how they come out of this potentially. John, I'll give you a first stab, and we'll let Dave throw in his 2 cents, and then we'll kind of go around and pick up with Joe.
Yeah, definitely. So obviously when COVID first hit, there's a ton of jobs and there was a ton of nurses coming into the market, like permanent nurses coming in that had not done travel or had not done it in some time. So we saw the agencies that had the infrastructure to take on that stress test and say, you know what, clients give me more jobs, and you know what, nurses come over here, we've got jobs, and be able to kind of scale up their operations. It worked out really well for them, and they were able to get a lot of nurses on some of those earlier contracts that didn't get canceled. So a lot of good stuff there. And I think as we've got this kind of downtime going, whether you're a firm that did well or not, I think everybody's evaluating how they did. And a lot of them are taking advantage of this downtime to say, you know, what can we do about restructuring our recruitment process, or what other tools can we bring on to capture better metrics around what's happening with that process? Or, you know, what technologies can we use at home if we need to work from home? A lot of them are evaluating, can we continue to work from home? Do we even need to go back into the office? So definitely a good time to assess everything that's going on and to start making some of those implementations during the kind of quote unquote downtime that they're having is what we're seeing, at least what I'm seeing.
Yeah, I think that you bring up a really good point. Like, strategy is a big part of how we come out of this, right? And you mentioned one thing that I think is really interesting. For years and years and years, and every year at SIA, there are conversations about essentially how can agencies become more efficient? How can they become more lean? We've seen the digital recruitment model obviously become a part of, this vertical. It is interesting to think about the fact that there may not necessarily be a need for an office space, or at least what we've traditionally seen with the traditional staffing models. So it'll be interesting to see how many opt for that remote recruiter team model, and how many actually come back to kind of the pre-COVID business model. Dave, your thoughts? Anything you want to add?
Yeah, sure. And to hit on that last point, and then maybe work backwards and address there. And I've been excited to see some of these staffing firms in the last couple of months not just have succeeded.
Your audio's a little choppy, Dave.
Oh yeah, all right, guys. Can you hear me a little better now?
Yes.
Awesome, cool. Yes, I've just been excited to see some of these firms really embrace the remote work concept and kind of have that light bulb go off in their head, like, hey, now that I can virtually hire staff from anywhere, I have a much bigger opportunity to build up a rock star team because I'm just not as defined by location, and that's been really exciting, to see that kind of realization for some people. And just in terms of the staffing agency kind of, COVID and into post-COVID, wind down into now, we saw a lot of companies, to Joseph's point, that were really smaller, that took advantage of like, okay, there's all these jobs available. I'm going to go for it. And they just jumped right in. They started embracing new technology, implemented things really quickly, which was exciting to see that happening, where the kind of mid-market and larger firms just didn't have the opportunity to do that because they were trying to figure out how they were going to stay ahead of the game through this big influx. And we've been excited to see, to John's point, people now taking a step back and saying, I don't know if this is going to last, 2 months, 4 months, 6 months, or 2 years, but however long it's going to last, like, I'm not going to let myself come out of this in the same position that I went into it in. And whether that's the people who did really well that just want to do better, or the people that had the brutal realization of like, wow, I cannot process this many leads. I can't get people into hospitals. And, not only did I, miss my opportunity to hit all these crisis rates and to help staff during the pandemic, but, now I, spent all my time going after these contracts I didn't win, and there's nothing left to fill. So it's been exciting to see people, taking a step back and a really hard look at how they can utilize technology, like, we're all offering, or services like
Moxie is offering to come out of this, 2 steps ahead of where they came in.
Yeah, absolutely. Absolutely. Joe, what do you think?
Yeah, I think you guys are right on. The interesting thing, Adam, you mentioned, 2008 and everything, and it's kind of goofy to think that we have some people that are in the industry, they're industry vets. They've been doing this for 10 years and they've never had a down market. You know what I mean? And it's just crazy to think that if you're doing something for 10 years, you're in a leadership position, right? So you could be running account management, you could be doing all these different things, and you've never had to go through something like this. And you're kind of a decision maker and somebody that's being leaned on in a lot of cases. So I think that, probably, contributed to a couple of the people that were a little, scared is the wrong thing, concerned, I suppose. And so, what we saw, similar to, I think what you guys were seeing, the people that made that decision, like they said, like, what am I going to do? Right. I can't just sit here and do nothing. We have to start implementing technology, or in the case of Moxie, you guys obviously have a technology platform, but we're going to take this opportunity to make ourselves better and kind of try and figure out what that new normal would be, regardless of whether it's A or B. We have an opportunity to kind of invest in the team. And so, with what you guys do at Kamana and what you guys do at Moxie, that's a big part of it. We know how busy it used to be, right? I mean, I have friends that do it, right? People I've gotten pretty close with. I can't even get them to return a text because they're so busy. It's just, I'm trying to get this nurse ready to go, do X, Y, and Z. And it's insane. And so, what we've changed to, and I've seen this model with some of my very successful clients in healthcare, but also outside of healthcare, the idea of like, I'm a talent agent, it's kind of like a soft recruiting where I don't want the people that are looking for the jobs, right? I want to recruit good rock star, in our case, nurses, whether they're looking for a job or not, right? I want to get the people who have the skills, who are excellent at what they do. And when they're ready for a job, I just want to be the first call that they make. And so that kind of investment in the future, I mean, we probably all try and do it with our own businesses, even with our own lives outside of business. And you always get kind of caught right in that operational mentality as opposed to the strategic and kind of that investing for the future. So I'm hoping to see a lot more of that. I've gotten a lot of, we've had a lot of good conversations, and I got a lot of, hey man, like, it's crazy right now. Right. And I get it. And you can't force somebody to make that investment in the future. But, I'm hoping that it did give people an opportunity to think about it, even if they weren't seriously considering, right, something like whatever the three of us offer yet, but at least hopefully we're on the radar now.
That's great. Excellent. Thanks, Joe. Joe, talk to me a little bit about how Great Recruiters actually works. Can you get into a little bit more detail and let those who aren't familiar with Great Recruiters kind of understand how it works?
Yeah, every time somebody asks me this question, I basically just describe what a demo looks like. So I have to be better about that. So I need to like come up with analogies or something. But, essentially, one of my analogies is like if an ATS, you decide to go with Bullhorn or something, you're implementing it. That's like building a house. It can be very complicated, even if you have a really good team on both sides. There's a lot of links to that chain. So what Great Recruiters does is we're kind of like the Nest thermostat, or the Ring doorbell. So essentially what we do is we automate the ask. You guys are recruiting vets. The idea here is some of your best referrals could come from somebody that you've never actually placed. And so we know that you guys make, or our clients make, really good experiences for the nurses. So we're just going to capture that. People are 10 times more likely to write a bad review than they are a good one. If you go to a restaurant and have a horrible experience, you're 10 times more likely to write about that than when you go to a restaurant and have a good experience. But we know most of them are overwhelmingly positive interactions. So at whatever stage, whether it's a submittal stage or an interview stage or whatever, we're going to automate the ask. We ask somebody, the nurse, to leave a review. And again, it's overwhelmingly positive. And generally, if it's positive, we're also going to ask for a referral. People aren't getting referrals because they're not asking. And so we do both of those things. It also works, like I said, really well with teams that are expanding. They get to you again. If I ask any of the clients who their top recruiter is, everybody knows who it is without question. This is a really good tool for them, but it also shows some of the softer skills that aren't just, again, like the phone calls, submittals, interview, placements. We're going to see that when you make good experiences, right, and we have our own little leaderboard, if you get people to give you reviews, if you get people to give you referrals, those things all are traits of a great recruiter, I suppose. And so we want to capture that information and make it actionable for the agencies.
Nice. So in companies that we work with, one of the things that we actually have taken a closer look at is how do we get that quality metric? Because like you mentioned, like phone call submittals, right? Talk time, all these other variables, deals, and all these things. It's kind of it's more of a quantification, right? It's always tied to performance, but there's also that missing piece, right? And that's what you guys kind of solve that problem, right? You give kind of a way of really measuring how that recruiter's interactions with folks that he's talking to or engaging with, he or she is engaging with, how that's impacting the person on the other end. I think that's awesome.
Yeah, exactly. Just one other thing that I think is kind of unique, and it happened, a little just before I came on board. It's, what it is, it's about kind of placing yourself, right? What's the legacy of your company? And so, yeah, we do the 5 great traits. So we want to know somebody genuine, responsive, experienced, an advisor, and transparent, right? Those are important things for a recruiter. I'm sure you guys teach a lot of that stuff when you go into an organization, but we also have a few clients, and we started this, like I said, a few months ago. We have their compliance team on it as well, right? I mean, these people, they don't always get the pat on the back. They don't get to run up to the front of the office and bang the gong and celebrate a BLS being submitted. And so when we had a client that we discussed this with, we're like, hey, we could do this for the compliance team. Sure enough, they loved it. And so now they kind of feel like part of the team. You have some other KPI that you can incorporate, whether there's bonuses or different things you can do on the compliance team. And frankly, they make a great experience for the recruiters as well. We actually found that the compliance team was driving referrals. So these people that were not like, producers had such a great experience that when they asked, or when the nurses were asked, they actually referred other nurses to the agency based on their interaction with the compliance team. So yeah, it's kind of a neat piece. I'm excited to see, where this thing goes next.
That's great. So, I mean, you really also create some pressure on the recruiter, right? I mean, honestly, thinking about it as a former recruiter, I know that this automated process is going to happen. There's an accountability factor going on there.
Depending on the audience, I either I bring that up or not at all. So if I'm talking to the team leads and the owners, right, that used to be in there recruiting on the front lines, they know they can't be on every single phone call. But they'd like to make sure that, somebody's putting their best foot forward.
So it seems like a no-brainer right now in this environment to use a service like Great Recruiters, because we talked about quality being such an important piece, such an important element. It's always important, but it's also always important that we're building around a strong core team of recruiters. And what better way to do that than to really identify if there are any issues, right?
Yeah, I would love to do a case study and see what the great recruiters, what the great traits scores are for the recruiters who've gone through Moxie training versus the ones that haven't. I think that they would have a much higher ranking.
Yeah, we should definitely do that. That sounds like a great idea. Yeah. All right, John, Dave, whichever one of you, I guess, that wants to tackle this from Kamana, if you both want to go. Talk to me a little bit about, in greater detail, about what Kamana does and how agencies benefit from partnering with Kamana.
Sure. I'll start it, Dave. I did want to say one thing that I think is really cool about what you guys are doing, Joe, with Great Recruiters is, as a nurse, sometimes you don't know how to kind of pay back your awesome recruiter, right? So you've got this, recruiters do a lot for you, and a strong recruiter will change so much, not just to what contract you get, but your experience on going through it. Like this is your sidekick. It's not just somebody that's connecting you with a job, but oftentimes you don't know how you can pay them back. You'll see nurses try to tag their recruiters on Facebook, and they're trying to give back. So to give like an actual meaningful way where I can not just leave you a powerful review, but it also is going to bring more of my peers and other nurses to having that great experience. I think it's really cool for the nurse to be able to do that. But yeah, what does Kamana do? So, you guys are doing a good job with creating that awesome recruitment workforce, right? So you've got all these awesome recruiters. and they're connecting with awesome travel nurses. And what is a huge tragedy is when you've got that great connection, but the job gets filled because the credentialing took too long. So, what we do with Kamana is on the nurse facing side, whether they have a Kamana profile, which, they can go to kamanahealth.com and create a free independent profile that they can securely organize and share their data with recruiters, and it's free for them, free for that recruiter. There's that piece, or whether it's a staffing agency using Kamana, giving that nurse a way that if I connect with a recruiter and they have a great job, I should be able to pull out my phone and start that application, that onboarding, give them my BLS, get them the things they need to put me at the top of that list for that submittal, because there's no bigger bummer than one of your other nursing peers beating you to that awesome job. And then after that, you get into the onboarding process. There's all this information that's needed. So giving the nurse a centralized place where they can get all of this stuff over to the staffing agency that's secure, that's mobile friendly, that's intuitive, that's specific to healthcare staffing, because we see a lot of tools out there that were built for construction staffing, and they kind of just throw it into healthcare staffing, and it doesn't really work. So yeah. And then with that ongoing relationship, you've got your awesome recruiter there, but giving a centralized place where you can chat and communicate with them, go into that same Kamana profile to sign your documents and kind of do everything going forward. And maybe I'll pass it to you, Dave, to talk about some of the benefits to the agencies.
Yeah, that was all really good. I think the only thing I'll add is beyond, to touch on Joe's point of the candidate experience and the recruiter being such a core thing to that. I mean, effectively for staffing firms, we give them the tool to provide a frictionless candidate experience from a technology onboarding application standpoint. And then when you get beyond that, initial, okay, I've given the nurse this mobile friendly way to apply and get submitted. And the cool thing is, John mentioned, if the nurse already has a profile, they literally just key their credentials in, authorize the data to be submitted to the staffing agency's portal, and all the stuff that, recruiters are fighting tooth and nail to collect, and compliance teams are fighting tooth and nail to collect. It goes from, days or weeks to, minutes, if that person's already prepared. So beyond that process, just building in as much as, possible for the staffing firm to effectively make Kamana be all things candidate facing for the nurse, where they're getting automatically notified if they're expiring credentials. We're not putting the burden of having to manually run these reports or send emails or give phone calls about, all the dynamic credentials that are expiring all the time. And then just being able to, track that stuff in a consistent manner without the typical workflow of, texting this, emailing this, putting this into this system, putting that into that system, sending DocuSign for this and using the ATS for this. I mean, so taking that entire fragmented experience and bringing it all into one place for both the candidate and compliance team to track through the process.
Fantastic. So 2 great companies, Kamana, and we've got great recruiters. Thanks for joining me, guys. I give you the opportunity to ask any questions that you might maybe want to throw out. If you've got any questions you want to throw out, shoot.
I've got a quick one, Adam.
Sure.
What are your thoughts, or how are you advising firms that are looking at, the benefit of having an in-house recruitment team that obviously, as you can train them and coach them and manage them ongoing, versus doing that remote? Do you have a big feeling, because there's obviously benefits to doing it remote? You can access different cities and you've got a larger kind of talent pool there. What are your thoughts around the remote model?
Yeah, that's a great question. I actually am asked that question a ton. And I think that really what it comes down to is you can do this job from home. We know that you can do this job from home. Actually, one of the clients here in Omaha, a larger client, found through this that probably 50 to 60% of their workforce didn't want to come back. They worked better from home. They were putting in more hours from home, which is something that I kept hearing over and over. And I kind of didn't believe it at first. But then when I looked at kind of where the recruiter's performance was, it made sense. They were spending more time, probably time that was different time during the day than what they would spend in a traditional office. So, you can make contact, make connections that you probably couldn't make during that 8 to 5 if your peak calling is happening later in the evening, for example. So my advice is it does take a mature workforce to work from home, meaning they need to be self-disciplined. So if there's one thing that I look for in hiring someone remote, it's obviously the ability to be self-motivated, so intrinsic motivation, and someone who's able to discipline themselves, right? So to be very focused and stay focused and have a dedicated workspace. So my advice is if you have the talent that can work remotely, absolutely do that. And like you said, you can recruit folks from all over the country. So it really widens that talent net that you're able to really go out and get more folks. So, and that's what we've really found over the last couple of months is, thank goodness we created this online platform, this training platform for recruiters, because now there's an opportunity for agencies looking to train those travelers that they're bringing on from multiple locations. So we're excited to be in that position, and I'm excited to be here with you guys. I think that our companies are very well aligned. We're all very focused on creating a great experience for everybody involved in travel healthcare. There's a long ways to go, a lot of things that can be improved in this industry, and I'm excited to be partners with you guys. Anything else? Joe, you got anything?
I think I'm good. It is going to be funny though. I mean, you guys probably have seen the same thing, but every single client I had with my last organization, every single one of them moved into a bigger and better office space while their clients are just growing like wildfire. And I know you guys are down in Omaha, so whether people are buying the building or, writing a 10-year lease, it's nothing I can help with at Great Recruiters, unfortunately, but I am interested to see what happens there. And I'm assuming the ones that haven't made that investment might think twice, but yeah, I don't know. I just a parting thought, I suppose.
Man, I think you go with a small building and you have your team working remote. Yeah. Sounds like a good combination. Great way to keep costs down. Allows you to transfer more of that to either keep more of it as a profit or transfer more of that to the healthcare professional.
Sure.
Or both, right? So there's opportunity there. Thanks, guys, for joining me today. I really appreciate it. Second time's a charm.
Thanks for putting it together, Adam.
Yeah,
Thanks,
likewise, Adam. We appreciate it. Thanks, John. Thanks, Joe.
Bye, guys.
Take care, guys.